Hello and good afternoon. Today is May 21st. And welcome to today's COVID-19 press conference with the county's public health experts coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vaughn Do Reynoso, and Dr. Henning Ansorg, the county's public health officer. Following their updates, we will open it up to questions from the news media. This press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Julia Townsend. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSB TV 20. And with that, I will turn it over to County Public Health Director, Dr. Vaughn Do Reynoso.
Thank you, Gina. Good afternoon and happy Friday to everyone. Let me start our briefing with some data trends in Santa Barbara County. In order for us to reach the yellow tier, we need to average less than 9 new cases per day, and our case rate needs to be below 2. Our testing positivity has been in the yellow over a month. So over the past few days, we have met these criterias. If we continue to practice precautions to prevent COVID infection, we may get to our first week of credit in the yellow tier as soon as next Tuesday. Note that we will need 2 weeks in the yellow before we can move to the yellow tier. Next. Of the 362,820 doses received, we have administered 173,177 doses. We have administered 138,086 second doses, and we have administered 11,910 of the single doses. Of all the doses that we have been allocated, we have administered in our county 89.1%, with the remaining 11.9% committed towards appointments. Next. We have, based upon the number of eligible Santa Barbara County residents 12 years of age and older, 61.3% have received at least 1 dose of the vaccine. Again, of the total number of eligible Santa Barbara County residents age 12 and older, 49.4% are fully vaccinated. And I want to compare this to the whole population. So of the whole population in Santa Barbara County, about 51.9% are vaccinated. And you can check our daily progress on our website at publichealthsbc.org. Next. This is something new that I'd like to share with you today. This chart describes the proportion of vaccination by age group. So starting from the bottom of the chart, second row, describes the vaccination among 12 to 15-year-olds. And I want to pause here and just say that it's been just 8 days since the Pfizer vaccine was authorized by the FDA for people aged 12 to 15. We, as a community, have vaccinated 15% of our 12 to 15-year-olds. That is an amazing feat to be celebrated. Of the 16 and 29-year-olds, 40% are fully vaccinated, 9% are partially vaccinated. Of the 30 to 49-year age group, 43% are fully vaccinated and 5% are partially vaccinated. Of the 50 to 64 age group, 66% are fully vaccinated with 4% partially vaccinated. Of the age group 65 to 74, 67% are fully vaccinated and 12% are partially vaccinated. With the 75 plus, 73% are fully vaccinated, with 8% vaccinated. So going back to the 12 to 15-year-olds, we are excited that 15% have received their first dose, and we look forward to more joining this group. Next. First and second doses remain widely available countywide. To get connected to a COVID-19 vaccine appointment, please visit myturn.ca.gov or call 211 and select option 4 Monday through Friday from 9 to 5 p.m. As well, there are many clinics that don't require appointments, and they do accept walk-in options. So please visit our website at publichealthsbc.org for those walk-in opportunities. Next. I'd like to give an update on our mobile vaccine program. Up to date, we have completed 86 mobile clinics, and the total number of first dose or one dose completed stands at 5,395. We have expanded into offering mobile clinics at farmers markets, swap meets, open air markets, grocery store parking lots. Please contact Mobile Clinic at sbcphd.org to schedule a vaccine clinic, or visit our website to view future clinics. I'd like to touch base quickly on school celebrations. School staff, families, and students have worked so hard this year to create plans to honor special occasions. I myself have a daughter that is graduating this weekend. So these are milestones that I'm glad we can get finally to celebrate. And so those plans include specific health and safety protocols. These events are limited to a certain number of guests to respect social distancing as we continue to assure that people of all ages in our community are fully vaccinated. So we are asking for everyone to work together to respect this guidance that the schools have put in place as we look forward to full reopening on June 15th. I want to end by continuing to acknowledging all the partners in our county who have been vaccinating our community at our press conferences and board briefings this week, since they have been key to vaccinating our 12 to 15-year-olds. I would like to thank Cottage Hospital, the Lompoc Valley Medical Center, the public health mobile teams, the public health medical operations team for their school-based clinics, and pharmacies and other providers who have joined us. In addition, I want to thank all the community partners who are doing outreach to remove barriers to getting the vaccine. These combined efforts contribute to our county reaching the 13% of 12 to 15-year-old populations with at least one dose. Lastly, as these pictures show, our heroes for this week are the 12 to 15-year-olds and their families who took the step towards being fully vaccinated by getting their first shot this week. We were able to capture these photos at our various clinics throughout the county. Thank you all for your service to Santa Barbara County. Your actions will protect the health of our families, our friends, and our neighbors throughout the county. Next. So again, please get vaccinated. Until then, please also wear your mask, maintain your social distance, and get tested if needed. And with that, I'd like to introduce Dr. Ansorg, our County Health Officer.
Thank you, Dr. Dovenoso. Good afternoon, everyone. I would like to take this opportunity and address the revised masking guidance again. As you know, the CDC and the California Department of Public Health no longer mandate masks when being outdoors, irrespective of your vaccination status. California does, however, still require masking for public indoor settings like movie theaters, stores, banks, public transportation, and the like. Come June 15th, this mask mandate for indoor venues in California will phase out. At that time, the entire blueprint and tier system will have served its purpose, and the Public Health Department will serve in a more advisory role. We are counting on that over the next 3 weeks. Until then, even more Californians and Americans will take advantage of our outreach efforts to receive the COVID vaccine, which in turn will protect them and everyone around them from severe COVID or death from COVID. Healthcare facilities and other employers are subject to the OSHA COVID-19 prevention emergency standards, which are scheduled to get updated in late May or early June. And the update will address the need for masking at the workplace depending on vaccination status. Similarly, schools will soon receive an updated masking guidance as well. This will take into account that minors 12 years and older are now able to get immunized. Regarding travel, if you are planning to travel, we strongly recommend to get immunized at least 2 weeks before your trip. Also, it is essential to consult and follow the CDC travel recommendations and the latest CDPH travel advisory. Due to the fact that internationally, the vaccination effort is lagging far behind the US effort, it is still recommended to wear a mask when at airports, on airplanes, or other public transportation vessels. Regarding variants, we are very pleased to inform you that the local virology lab at UCSB is now under contract with the state health department to run a higher volume of routine surveillance sequencing on specimens to identify mutations of the virus. We are in the process of updating the dashboard to post the recently reported variant results processed through the state labs. We anticipate to be able to complete this update by next week. Please be reminded that our available vaccines are effective against all current variants of concern, and that these more transmissible forms of the virus will have a very hard time to spread in a widely vaccinated population. We are very fortunate in California to have already vaccinated over 60% of the population with at least one shot. This is the main reason why the case rate, hospitalization, and deaths have plummeted over the past month. This is actually the light at the end of the tunnel we have all been waiting for. We are now finally able to safely engage in a more normal life again. And this is mainly due to your effort and your cooperation. As the public health officer, I thank you for that.
Thank you, Dr. Ansorg and Dr. Do Reynoso. So we will now open it up to questions from the media. First is Blake Devine with KYT.
Hey guys, I just want to clarify, obviously you guys touched upon it just a little bit, but what exactly will be the state of play on June 15th? What should local residents in Santa Barbara County be expecting to just see differently? Is it just going to be like a light switch turned off and on with the masking and the adherence? I mean, what should people really be preparing themselves for 3 weeks down the road?
I can start. So on June 15th, we can expect that businesses can open their doors without COVID-19 constraints on capacity or requirements for physical distancing, and where people who are fully vaccinated no longer need to wear a mask in most situations. So the tier system has been in place for, I believe, 9 or 10 months, and so that will go away. Californians can expect that our state will align with the recommendations from CDC when it comes to travel and masking. However, I do want to point out that employers will still need to abide by Cal OSHA regulations, whatever they may be. The only other thing that we know about June 15th is that California will require organizers of mass events, indoor events, meaning with those that exceed 5,000 people, to verify that the attendees have to be either vaccinated or recently test positive. And the state will recommend but not require the same for outdoor events with more than 10,000 people.
And then same question to Dr. Ansor, just should people, I guess my question is, how should people be monitoring who's been vaccinated and who hasn't been vaccinated as far as the mask compliance after June 15th?
Well, that is difficult. You cannot run around and ask everybody, are you vaccinated or not? You can ask in your circle of friends and family, obviously, so you feel safer to mix and mingle with those friends, obviously. What I would also stress the fact that persons who are have a weaker immune system, for instance, or who therefore potentially able to catch COVID despite being vaccinated, they should, of course, still be more careful. You know, I foresee that some people will prefer to continue to wear a mask in certain settings. I would not recommend that we go and necessarily go back to old behaviors that tend to spread viruses. I think all of us have learned certain behaviors over this very long 1.5 years, and we should all take a really good look at that. How do we want to protect ourselves and our loved ones and our neighbors in the future? It's quite possible that more viruses will become a problem in the near future, and I think we all collectively have learned very hard lessons on how we have to deal with this. Now, so I'm elaborating maybe a little bit too much, but I think it is basically what we're anticipating come June 15 is a phase of the post-pandemic, at least for the state of California and the United States. So that is what we're anticipating, and that is what we've been preparing for.
Let me just ask you a quick follow-up, if you don't mind. Vaughn was kind of speaking about how we're about to hit those yellow tier numbers this week. Why, from a public health perspective, it's still important for us to reach the yellow tier just to show how far we've come? Because a lot of people are thinking, why do we even care about what tier we're in right now? Because in 3 weeks, it's just going to open up. But why is it still important to reach that yellow tier to just show how far we've made it as a county?
Well, I would argue that it is a very nice milestone to reach. We have never had such low infection rates. We have never had such low hospitalization rates. And that is just nice, really reassuring to see that we are on the right path. So the significance is definitely different from like 6 weeks ago, when we try to reach the red tier from the purple tier, because it had much bigger consequences and by reaching those milestones. So the yellow tier is really lacking that kind of luster, because we all know that come June 15th, the whole tier system will have served its purpose.
Thank you so much.
Blake, Before we go on, I just want to make sure I gave the right information. So earlier when we were talking about what we can anticipate June 15th, so when I talk about California requiring organizers of indoor events with more than 5,000 people, the requirement will be that for the event organizers to verify that the attendees are either vaccinated or recently tested negative. So just wanted to make sure that I give the right information.
Thank you, Vaughn and Blake. Next up, we're going to hear from Santa Barbara News Press, followed by Newshawk, followed by Santa Maria Times. So Madison with the Santa Barbara News Press, go ahead and unmute, and there you go.
Thank you. Thank you, Gina. I just have two quick questions. The first is, I know that there was some concern a few weeks ago that there was a slowdown of the vaccination rate in Santa Barbara County. And I'm curious if that is still a concern, or have you guys seen vaccination rates on the uptick again?
I would say that with the expansion of eligibility to the 12 plus, we have seen an uptake of vaccine, especially among that age group and their families. But we certainly have plenty of vaccines and wish that more community members will fully utilize the availability of vaccines in our county.
Okay, great. And then I know that there's been some areas across the US, and then I even heard Los Angeles County today is starting to offer some incentives to take the vaccine. Is that something that you would consider in Santa Barbara County?
We are in discussion with our council and our partners, as well as with the state on that option.
Awesome. Thank you so much.
Thank you, Madison. And next up, we're going to Tom Bolton with Newshawk.
Good afternoon. I have just a couple of questions today. The number of active cases, infectious patients in the county has continued to decline. It's just a little above 50 today. But at the same time, over about the last 10 days, the number of people in the hospitals has edged up from 6 to, I guess, 15 today. And I'm wondering if you could just tell us what's the explanation for that?
Well, that's a very good question. It's just that apparently it just shows that COVID can potentially be a very, very severe illness, requiring hospitalization and even intensive care, and can lead to death. So it's very difficult to predict who will require hospitalization or who will be fortunate to only experience mild symptoms. So it's impossible to really predict that at the moment. There are certain risk factors that predispose somebody to experience more severe symptoms, but even healthy young people and athletic people can come down with severe COVID. So that's the conundrum that the clinicians have been dealing with all this time, and it's still ongoing. Even it's just on a much smaller scale.
Okay, thank you. And then a related question is, demographically, who's ending up in the hospital today, and is that different than what we saw a month ago or 6 months ago? And I'm talking in a general way.
To my knowledge, it's very similar still.
So it's not that we see a different type of population that is getting sick enough to end up in the hospital, or age group or anything like that.
Well, let me rephrase that. Actually, we see less elderly people ending up in the hospital from before. The vaccination rate in the elderly is much higher. It's almost 75%. So we do see more people in their 40s and 30s in the hospital than we used to when we have the high case rates, percentage-wise.
And it's safe to assume that virtually all those people are not vaccinated?
Correct. The cases that people need to be hospitalized after having had the vaccine are extremely rare. There's about a handful or maximally 2 handfuls of cases in the county. And none of them ended up in the intensive care unit in Santa Barbara County. And they all just had a short hospital stay. So I would not frame that as a vaccine failure, because if they hadn't been vaccinated, they most likely would have had a much more severe case. We know that the COVID vaccine prevents severe COVID in anywhere between 94 to 97% of cases, and it does prevent death in almost 100%. So you can get reinfected, which is extremely rare. And it's even rarer that if you get reinfected, that you would require hospitalization.
Alrighty, thank you very much.
Thank you, Tom. And next up, we are going to Laura Place with Santa Maria Times, to be followed by the Daily Nexus.
Hi, everyone. Thanks, Gina. So my first question, I wanted to circle back to something that was on one of your slides, Dr. Del Reynoso, about graduation ceremonies. So did it say that for all ceremonies, I'm wondering if this includes both indoor and outdoor, that attendees will have to present a vaccination record or recent negative COVID test?
Laura, that's a great question. So high school graduation ceremonies will require guests who are age 2 or older to either provide a negative COVID-19 test result taken within 42 hours prior to attendance, or show proof of full vaccination. And I am not clear on whether this includes outdoors or indoors, or both. And
Okay. Yeah, I was wondering because I've seen a few, places are starting to announce ceremonies, and they didn't say that people won't need those, records, but they haven't stated that explicitly.
I would
they just said
imagine
it's
that
limited.
I would imagine that it may be a school district by school district as well.
Okay, so districts can decide. It's not like a sweeping regulation for indoor or outdoor.
I'm not certain. Dr. Ansor, do you know?
Yes, we did give guidance to all superintendents and school districts what guidance to follow. And that's the guidance that is active for live events in outdoor settings. So there is a difference between indoor and outdoor settings and the number of people who can attend. I don't have the breakdown right in front of me. I'm happy to share that with you if you need it. And but I would also recommend that anybody who is planning on attending a ceremony to ask their particular school about the requirements.
Okay, cool. Yeah, further clarification would be good. I'll check back in about that. And then, with masking still required right now, like in stores and retail until June 15th, regardless of vaccination status, it seems that, with the CDC coming out and saying that it was okay to, go indoors without masks now, it seems like maybe there's some confusion for some stores, because it sounds like, at least in Santa Maria and some other areas, public health has been informed of some stores that have been saying, people can come in without masks if they're vaccinated, even though that's, not currently true. So I was wondering if you all have heard of a lot of locations doing that, and if you've been able to just provide outreach and clarify, and if you've gotten compliance that way.
I'm not aware of any particular complaints that have come in, but then again, I would have to double check. Maybe Dr. Doran also has some more information on that.
I am not. I know that I have heard some reports, but so far we have not received complaints on those.
Okay. So is it up to like a certain entity to be like checking to make sure stores are doing that, or is it up to a certain entity to like reach out to a store and clarify that if they're found to not be in compliance? Would that just be like an OSHA thing, or or the
So-
city?
It's a Cal OSHA requirement, and so typically, as in previous renditions of guidelines from CDC and confusion over whether who's abiding or compliance, we do encourage that if there's a compliance issue to file a compliance concern via our website, the county's website. And then we would send out our county ambassadors to educate and to do outreach and inform the employer. And ultimately, it is a Cal OSHA requirement and compliance enforcement.
Okay, thank you for clarifying that. And lastly, I just wanted to follow up on something you mentioned a couple weeks ago when I had asked about, ongoing efforts to increase vaccination rates in North County and Santa Maria. And you had mentioned a few groups you are maybe working on finalizing some plans and further efforts with. I was just wondering if there's any update in that area.
Yes, I knew you were going to ask for an update, so I am prepared to share it with you. So we have two different grants, and the ink is dried on one of the grants. So it is a partnership towards health grantee, and we are going to be issuing a press release Monday or Tuesday. But through the philanthropic contributions at the state level, our county is able to engage 5 different groups to do outreach and education. And these 5 groups include MyCop, CAUSE, Lompoc Valley Community Healthcare Organization, Casa de la Raza, and the NAACP Santa Maria Lompoc branch. So that is that is the TTP grant. The other grant where the ink is not dried yet because we are still waiting for additional information from the state will be a grant via the TPA, and that will go to support Marion Regional Medical Centers, the Lompoc Valley Medical Center, Herencia Indígena, and Fighting Back Santa Maria Valley. And the focus for these 2 grants from the state is direction on increasing vaccination, outreach, and education, as well as uptake among our hard to reach populations and communities. So these 9 groups will be working on not only outreach and education, but navigating the vaccination appointments and walk-up centers, as well as providing vaccination vaccines in various settings in North County and in Lompoc.
Okay, thank you so much.
Thank
Certainly.
you, Laura. And next up, we are going to Atmica with Daily Nexus.
I hope everyone's having an awesome Friday. I'm going to warn you right now, I do have a couple questions and I'm really, really sorry. I will try to get them as quickly as I can. So the first one, as we're transitioning more towards mobile clinics, looking at just the age information that you provided about vaccines, Dr. Del Reynoso, do you think that mobile clinics in areas where there's a higher population of 12 to 15-year-olds and 16 to 29-year-olds will increase the amount of people in that demographic getting vaccinated?
Absolutely. I believe that we are now in the phase where we need to make sure that vaccines are easy, vaccines are convenient to get, and vaccines are offered in a comfortable setting. And therefore, the mobile vaccine program is able to offer and meet those criteria. We are partnering up with a variety of partners, including schools, including higher ed, including community-based organizations. And by making sure that we are everywhere, no appointments are needed, and in a setting that's comfortable and familiar, that we will get an increase in the number of people accepting the vaccine in these age groups.
Thank you. My second question is, so if June 15th, capacity numbers and various other regulations and rules that we've been adhering to are no longer going to be in place, I'm trying to put that into context of Isla Vista, a town basically known for its parties and large gatherings. Do you have any concerns about what might happen as a result of those regulations and rules going away? And on top of that, the current ordinances and fines that exist for large gatherings, what happens to those once guidelines change?
Well, we will still have guidelines for mass events. As Dr. Vondo Reynoso mentioned earlier, that would be 5,000 people indoors or 10,000 people outdoors. So like a huge concert or a huge event, it would be mandatory for the organizer to follow safety protocols. And so now our positivity rate is so low, it's just over 1% in the county, and in the state even, I think, closer to less than 1% of all tests turning positive, that the case rate is lower. So we are, especially if we are successful in vaccinating another 15 to 20% of the population, we would reach something relatively close to herd immunity, and therefore there will always be a pocket, here and there flaring up of an outbreak or something that is almost not preventable, but it does not warrant that everybody in the community has to be mandated to follow certain regulations. That is just, that does not fit any longer, because we are really approaching the post-pandemic phase. We will have to live with COVID for a long time, though. There will always, be the risk of a COVID infection, just like other infections, but it will not hopefully cause a horrific epidemic again. So I hope that answers your question.
Just as a little bit of a follow-up, so, for house parties happening in Isla Vista, usually somewhere between, like, sometimes it's, 50 people, sometimes it's 200 to 400 people. At that point, what you're saying is it will be okay for gatherings like that to resume.
Yes. We would appeal to the responsibility and to the common sense of the organizers or the participants to be safe, to get vaccinated, to just take precautions as necessary. So the Public Health Department will be very happy to give advice, to help if necessary. So we are willing to work with anybody who wants help, but we will leave the role of regulating and mandating agency as of June 15th.
Got it. And
Attica, I just want to add a couple more points. I'm really encouraged by the efforts that we have in partnership with UCSB. I know that if we look at the total number of students registered for spring quarter, approximately 64% have received at least one dose. So that's really a good number. And in addition to that, we will continue to offer mobile vaccine clinics on campus and at the healthcare center, as well as in Isla Vista. So I think that all those combined efforts will lead us to a higher than typical percentage of Isla Vista and of UCSB students living in Isla Vista vaccinated, and so that offers some protection as well as we enter into the fall season.
Gotcha. And just as the second part of the question was relating to ordinances, citations, and fines. Is that within your realm, or is that more Board of Supervisors upon your recommendation?
Well, once the once the health officer order is phasing out, the fines will not be applicable because of a health officer order. So I'm not 100% sure if Isla Vista or UCSB might have some regulatory authority, but it will not come from the public health department.
Got it. Thank you so much. Just a few more, I promise. So I know that, coming up, if UCSB will be in person as currently as planned, do you guys have any plans put together with UC Santa Barbara for, what masking looks like on campus, whether that will be required, whether that won't be, if there's a certain requirement for like lecture halls, or like what will campus life look like in the fall?
Well,
Vaughn, is that you?
is Vaughn trying to speak? Otherwise, so the mask mandate will be gone by June 15th. It is already gone outdoors. So I would anticipate that life on campus will look more normal.
Got it. Sorry, I was trying to unmute myself. Thank you so much. And that's actually that's such a big, I don't know, piece of hope. Like we're going back to normal.
Yeah.
Next question, testing. So what sort of testing, who do you encourage to get tested? What sort of testing protocols will be in place following June 15th?
So if anybody experiences symptoms that are consistent with COVID, infection of the SARS-CoV-2 virus, they please need to get tested, and if positive, isolate and notify, and then the public health department with disease control will help with information on quarantine and so forth, just like now. That is for symptomatic people. They should seek medical care, and just to make sure whether they're vaccinated or not. But we will no longer require these surveillance tests, that, for instance, athletes have to be tested once a week, or any of that will all fall away.
Got it. Last two questions. Is there any new information on booster shots coming up sometime either this year or next year?
There is a lot of chatter about that. Dr. Fauci was interviewed, and so he was hinting at the possibility that there will be an annual booster shot, but I don't think it's really fully decided at this point. Because the virus is so new, the vaccines are so new, we need time to reevaluate at certain, monthly milestones, how robust the immunity stays and for how long. Nobody knows at this point, because the vaccines have only been in trials since March, so that is just 14 months. And we are relying obviously on the CDC and the manufacturers of the vaccines to come up with surveillance testing and so forth, that we learn basically as we go, because it's so new. We all have to find out why we are experiencing this.
Got it. Last question. So I know public health has put in a lot of effort into reaching vulnerable communities, vaccine hesitant communities. So last question is just, how is that effort going as it like looking at houseless individuals, looking at various communities within the county that have been more vaccine hesitant?
I think it's going really well. I think some people are just really wary of these big vaccination clinics, or pods and things like that. They would prefer to go to their regular doctor, or go to have it at their church, or at a venue where they feel more comfortable. And we are trying to accommodate those people. And we are open for suggestions. We are very happy to send a team out to anybody who wants to organize a comfortable vaccine setting. We are ready to be a partner in that, and I think it's going really well.
Thank you, Atmika. And next up, our last questions will be from Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, everyone. Good afternoon. Okay, my first question, I'm sorry, it's about wearing the mask. Before June 15, I just want you to clarify a little more or one more time that right now it's only outdoors and indoors we need to wear the mask. But what about the employees? Can you tell us one more time, please, because our audience is very concerned about this, especially in Santa Maria.
Yeah, I understand. You know, any employer has to abide by the OSHA guidances, and they are in the process of revising them. And it's an uncomfortable time for everybody because there's so much uncertainty. They are meeting, they actually did meet yesterday, and they haven't come out with the guidance yet. So we're anticipating that any day, but it could take up to 2 weeks. So until we know what employers have to abide by. In the meantime, if you're in the privacy of your home and you have fully vaccinated friends and family members over, you do not need to vaccinate or social distance. And outdoors, as long as not vaccinated people are not in a crowd, nobody needs to wear a mask outdoors. Now, in stores, movie theaters, public transportation, and so forth, until June 15th, everybody, whether you're vaccinated or not, still needs to wear a mask.
Okay, thank you so much. And my next question is about if you have heard or if you have been informed about allergic reactions from the vaccine in Santa Barbara, especially from private hospitals, because as far as we know, they cannot share this kind of information with you. Or can you explain us something about this?
Well, we have now given more than 400,000 shots in the county of Santa Barbara. And there have been very, very, I mean, if you look at the big number of 400,000, there have been very few instances of allergic reactions to my knowledge. And I think that's reassuring.
Okay, thank you so much. That's all. Thank you.
Thank you, Fabiola. And that concludes today's press conference. The Board of Supervisors is not in session this Tuesday, and our next press conference is Friday, June 4th. But for daily and weekly updates, county public health experts provide live updates every Thursday at 11 a.m. on KUYT News Channel 3. Plus, daily reports are posted on the county's public health data dashboard at publichealthsbc.org. And you can sign up to receive email updates, including our new At a Glance Week in Review that we are starting to issue on Fridays, including tonight. To sign up for the e-news, go to County of SB, that's countyofsb.org, and select Join Our Mailing List in the upper right-hand corner of the homepage. And with that, we wish everyone a safe, healthy, and happy weekend. And thank you for tuning in. Until next time, good night.